Operation 000 Initiative is a package of care for adolescents living with HIV, which empowers them to take responsibility for their own health. The participants commit to ensuring zero missed appointment, zero missed drugs, and zero viral load. OTZ provides an active role for the adolescents, their caregivers, and healthcare workers in the design, planning, and implementation of the project.
My name is Anne Tuk, health worker with General Hospital 18 and Akwa Ibom State, Nigeria. General Hospital 18 started implementing the OTZ initiative in November 2019. It was built on an already existing adolescent support group in the facility, whereby then we only had 35% of adolescents living with HIV participating in the support group activities. However, OTZ initiative has successfully incorporated 100% of the adolescents and young people living with HIV in this facility into the support group.
Mrs. Ann introduced OTZ to my mother, and she told me about it in November 2019. I joined OTZ in January 2020. However, I was not consistent with club meeting because I wasn't interested. Mrs. Ann persistently followed up with me until one day in October 2020, I decided to come and be attentive during the meeting. When I came, I saw other young people like me who knew so much about HIV. They were trying to help other young people like them to live healthy lives. By associating with the OTZ members, especially the OTZ champions, who were mainly my peers, I was inspired to be an OTZ champion. After attending the capacity building on 3 OTZ modules, OTZ champion, peer-to-peer mentoring, and leadership, I was challenged to take ownership of my treatments. I started taking my treatments very seriously, and I volunteered to be a peer supporter in the OTZ club to help other people that might be going through what I went through. I did not miss any day of my drugs, and I keep to all clinic appointments. My last viral load was undetectable.
My name is Dr. Uyo Abamu, a technical assistant clinical services working with SIDHAS Akwa Ibom State. SE is not the only adolescent who has achieved this. Of 12,639 adolescents on the SIDHAS project, 11,637 enrolled on OTZ, and 7,636 have also achieved undetectable viral load. This is an improvement from 698 undetectable viral load results documented for adolescents before the introduction of the Operation 000 clubs in 2019.
In March 2021, out of 377 adolescents and young persons living with HIV in General Hospital Atinan, 88% have zero missed appointment, 87% have zero missed drugs, 92.5% have current viral load test done, 87% have suppressed viral load, 94% are on TLD optimized regimen for age, 94% are receiving differentiated service delivery.